Welcome to Med-Surg Mini number 21 on obstructive sleep apnea. The pathophysiology is that it's an upper airway obstruction that occurs during sleep. This causes irregular breathing patterns, such as cessation of breathing in the middle of the night. The way that this happens is muscle relaxation often occurs while we're sleeping. And as that muscle relaxation occurs, the upper airway narrows, causing increased air resistance. Then our inspiratory and intrathoracic pressure increases as ventilation and gas exchange decreases. Once the tidal volume equals 0, sleep apnea occurs. This is more common in males, and risk factors include having atrial fibrillation, nocturnal dysrhythmias, type 2 diabetes, heart failure, pulmonary hypertension, being the male gender, being obese, smoking, having alcohol use, especially right before bed, having upper airway trauma or abnormalities, entering menopause, or being between the ages of 40 and 65. Symptoms include loud snoring and snorting in your sleep, witnessed pauses in breathing, gasping, waking yourself up during sleep, oftentimes choking, having daytime sleepiness, poor motor coordination, impaired executive functioning, impaired visuospatial learning, and impaired storage and recall of information. It is first diagnosed by tracking our sleep history and then providing them with a sleep study, also called a polysomnography. In the sleep study, we measure their sleep and see if they have 15 or more disruptive events in 1 hour for a proper diagnosis. Management non-pharmacologically would be to provide them with a CPAP machine, weight management, having them sleep in an elevated position. We can give them sleep appliances, which moves their tongue forward and helps prevent some of those apnea events. If it's due to an anatomical cause, we could provide them with surgery and have them avoid any alcohol or sedative use. Nursing considerations would be to assess, provide them with education, and provide assistance with diagnostic testing. Nursing problems that are associated with obstructive sleep apnea would be risk for stroke or cardiovascular accident, sleep deprivation and fatigue, and ineffective breathing pattern. Medical complications is it can lead to hypoxemia, hypercapnia, respiratory acidosis, cardiovascular disease, and erectile dysfunction. Nursing considerations would be to make sure we're assessing vital signs, height and weight, sleep, rest, and activity cycles, and any edema. Education would be on CPAP use and weight reduction techniques. And that wraps up our discussion on obstructive sleep apnea.